Okay, this video is going to go over the steps for what to do if there is a blood leak alarm on your dialysis machine. What is going to happen is this bar is going to turn yellow. It's going to say blood leak ? Your pump will stop and your dialysate should go into bypass. The first thing you need to do is check your line, your red drain line. If this line has any pink tinge or red, that is a blood leak that we do not need to test for with test strips. What you would do is disconnect your patient without rinsing the blood back and notify the provider. If we have that alarm and this red drain line is clear, we need to test the dialysate for blood with test strips. So we have these test strips that we will be using. And what I'm going to do is take one of these out. I'm going to remove the red drain line. And I'm going to check this dialysate here. I'm going to run it under there for a few seconds. And I'm going to let this test strip sit out for 60 seconds to allow it to give us our answer. This means negative and this means positive on here. During this time, you do not want to hold down reset because that will allow the machine to start running again for 3 minutes, and that would give them their blood and dialysate that possibly mixed, and we do not want to do that. So you just need to continue to hit mute during this time so we're not giving them potentially blood back that is mixed with dialysate. After this has been resulted, if this is positive right away, then we need to disconnect the patient and call the provider without rinsing the blood back. If this comes back negative, we need 2 other negatives for a total of 3 negative test strips to confirm that there is no blood in dialysate. At that time, we would hold down reset to reset the alarm. If it still does not clear, then we need to hold down reset for 3 seconds to allow us to rinse their blood back and then pull that machine and replace it with a new machine.